First of all, I would like to thank the organizing committee for giving me this opportunity to present on the SILC initiative, training standard and certification in neurointervention, and I have nothing to disclose. And I think there is a global challenge in the neurointervention, and we know that there is worldwide gaps in the stroke intervention expertise and uneven distribution of neurointerventionalists and the mechanical thrombectomy centers globally highlight the critical access issue, necessitating a targeted training initiative to improve such stroke care, especially in underserved regions. And when we come to the geographical limitation in the access to the care, we see that the overwhelming majority of mechanical thrombectomy centers are located in the developed country, high-income countries, compared to other level of income countries, including upper middle and lower middle, and even in Africa, all income countries. So we actually have a disparities in mechanical thrombectomy availability, including access inequity, and we know that there is a huge significant geographical disparities between rural and undeserved urban areas lacking adequate mechanical thrombectomy facilities, and this, of course, will impact patient outcome. When we come to the global center distribution, we know that only 22% of mechanical thrombectomy centers are accessible to the majority of the global population, and this highlight the critical access issues in low-income regions. Additionally, when we talk about the workforce, there is a workforce shortage. We know that there is a global deficit in the neurointerventionist that exacerbate this challenge, and this necessitate enhancing the training programs to improve surface availability. I think when we come to the reality, we need to give a short overview on the current training landscape. And when we talk about the training standards worldwide, we can see that there is a huge variance in the global training standards. And you can see and glimpse these disparities between when we look at the guidelines for neurointervention training between different societies, including European one, Spanish one, CAST, and CCNR, and the GESNET guidelines. I think the situation in developed countries like in United States, there is something which is more structured pathway, including a comprehensive training framework, and also this pathway maintain a progressive certification structure and gaining hand skills during the multiple level of the training. And also there is a rigorous clinical experience metrics that can assure the quality of the program itself. Otherwise, in the global overview, there is gloomy situation where there is some regional training variabilities. There is impaction on the stroke care between different centers and different regions, and also this mandate and this call for a need for standardization. And this is why the SILC framework comes, and the SILC framework comes in three pillars: the SILC lab, the SILC training, and the SILC speed. And when we talk about the SILC training standards, this is very important because the training itself, the SILC is creating standards in the term of training, and this mandate a comprehensive certification process, ensuring a practitioner to demonstrate proficiency through rigorous assessment and the continuous education in neurointerventional technique. And this is something which mandate the accreditation quality and assurance, and this including minimum procedural volumes and faculty qualifications to maintain high quality training environments for neurointervention. When we talk about the second pillar, which is the SILC lab, this is something dealing with the capacity and the potentiality of the intervention stroke labs to deal with a high standard of metrics with the patient to improve the clinical outcome and the number of the treated person during a certain time. And when we talk about the third pillar, which is the certification of the pre-hospital or SILC speed, which is the certification of the stroke network and the pre-hospital network, I think this is very unique part of the SILC dealing with the pre-hospital stage, trying to enhance the care coordination and improving the gaps in the EMS area and increasing the access to the proper care and also maintaining a certain metrics and the quality to monitor how this network is connected efficiently to improve the clinical outcome of the patient. I think that the training continuum, in terms of the training continuum, SILC suggests different levels of the certification of training, and this is something which is structured competency development, and also created something like a quality metrics to improve and to maintain the the proficiency and the efficiency of different level of this training. For example, when we talk about the level 1 requirement for basic training, a certain time of training or certain duration of training is mandated, at least 12 months, integrating both theoretical knowledge and the practical skills essential for effective stroke intervention practice, and should be part of procedural competency breakdown, including a certain volume of procedure. For example, at least 150 procedures, including diagnostic angiograms, thrombectomies, and also to ensure comprehensive exposure to neurointerventional technique. And also at the same time, it mandate of clinical competency focus, emphasizing on the decision-making criteria, the intellectual and the mental activities to reach to the decision making of the cases. When we talk about different levels, other levels like the level 2 and the 3 requirement, of course, the higher number of the procedure volume needed, also more complexity should be involved, and also more specific domains should be explored, like pediatric and spinal training, for example. When we talk about the training program structures, there is some requirement to be achieved to have SILC accredited centers. One of them is the clinical foundation, force the qualified leadership, and of course, the comprehensive curriculum mandate. Faculty and the curriculum standard is also have certain requirement in the SILC, and the competency assessment is a main part of the SILC initiative. So evaluation process and overview is a continuous process in the SILC training program, including comprehensive assessment for the framework, also assessment of the structure competency level, and the rigorous graduation criteria should be maintained and should be achieved. Medical knowledge and the technical skills assessment, also another very important part of the SILC certification, including the evaluation of the framework along the time and the progressiveness of the gaining the skills, the hand skills of the candidates and the trainees in certain program. And of course, the graduation comes at the end of this process. And this is a requirement for the graduation, a requirement including achieving a certain volume necessity, a cognitive assessment requirement, and should be tested through test or examination, like oral examination of the candidates, and ongoing education mandate annual completion of CME credits, for example, to maintain current knowledge in evolving neurointervention procedures. Of course, SILC, including some governance and oversight. And the most important part is the SILC accreditation, SILC Act committee, which ensures the training programs meet rigorous standards, promoting high quality education in neurointervention. And its role as a council is to do accreditation process evaluation, compliance monitoring activities, and the collaboration with the standards alignment. Also, SILC encompasses certain innovations in its component. For example, it's something which is flexible to address regional disparity in training through certain tools like innovative e-training solutions, teleproctoring for real-time support, and the flexible training pathways according to the volume and the access in certain part of the world. And the SILC e-training platform features enhanced learning flexibility and the comprehensive feedback mechanism to ensure completion of certain deficient a part of the training segment of the training program to complete their main requirement for a certain level of training. The maintenance of certification is another part, which is integral part of the SILC. And of course, it's something assuring that there is ongoing assessment and adaptation for the quality improvement. And this is something like, there is something like an annual CMOC requirement, the importance of ongoing education. And of course, when we expected that the implementation of such a global SILC program will impact the stroke care and advances the global stroke care through standardization of the training protocols, addressing accessibility crisis, and also addressing workforce shortage through different domains, and improving patient outcome through presenting a well-unified, standardized procedural treatment. I think this is the main integral part of the concept of the SILC training. And I would like to thank you for this lesson. And I'm happy to have any question.